Hello, my name is Elena Wiesner, and I am the Director of Marketing and Business Development at McLaren Bay Region. And thank you so much for joining us today for this important conversation with our community. We're calling it It's Okay to Not Be Okay. Today, we have our Director of Behavioral Health, Bridget Cashin, doing a wonderful presentation. And we want to encourage everyone to leave their questions in the comment section. And once Bridget is done with her presentation, we will go through and answer each and every one of them. So without further ado, I would love to introduce Bridget.
Hi, Elena. This is Bridget. Thank you so much for having me today. I really appreciate it. We certainly need to bring mental health to the forefront and make sure that we talk about it just as we talk about any kind of physical health or problem. And certainly those of us that had COVID-19 have gone through that. I think all of us have had some mental health challenges from any degree. And certainly the national attention that we've had on the Olympic athletes, as well as those that just are champions, like Naomi Osaka, who was a tennis champion. She recently had to end her French Open, I believe. And she's a famous tennis player. And one of the interesting things is that she was fined for not participating in some form of TV show or something that she was supposed to do after. And it's just interesting because it was good that she brought it up, and it's great that she admitted that she was having some mental health problems so that we can all see that they're just like physical problems that we have. The interesting thing is that she was fined for not participating, and you just wonder if she had broken a bone or had something that was sprained and wasn't able to make that same obligation that she had, would that have really, would she have been fined for that? And again, that has to do with the mental health stigma that we have. So fast forward a couple weeks later, when we had the Tokyo Olympics, and Simone Biles, the world's most famous gymnast, who from the outside looks like she's ready, she's prepared. We know physically she's prepared, and just mentally had some struggles where her brain didn't work the same way, and she was unable to perform. And fortunately, they were able to keep her on the side, and she was able to support her team. And it didn't look like she was, had this a strange or odd thing going on. It was a normal thing. And I think that's what's nice about having those examples, is that we've had more national attention on behavioral health, and it normalizes the struggle that people have with their mental health. And mental health is as important, if not more important, than a person's physical health. And that certainly depends on the situation. But as you can see, you can be the best athlete, you can be in the greatest shape, but if your mind and your body don't work together, then you're going to run into some difficulty. And that's what we're here to talk about tonight. We're going to talk about good mental health and ways to keep good mental health, as well as identifying signs and symptoms of poor mental health or poorer, and identifies ways to get mental health treatment and for yourself or for others, and identify treatment options for mental health issues. And then we'll have a question and answer. And once again, like Elena said, please make sure you write your questions down in the comment section, and we will have that after this presentation. So when we look at mental health, the mental health continuum, we look at people that have good health on one side, and maybe degrees of poor mental health that goes to the more emergent mental health issues. So we're going to talk a little bit about those. I think it's always good for us to understand that in order to have good mental health, we have to practice self-care daily. So people that have good mental health have the ability to concentrate and learn. And so when you have poor mental health, and again, this is from, you might have one bad day to you have, 2 months of not being able to do things, but people have poorer concentration and they're not able to learn. Learning is challenging because they're very focused on what's going on internally with them. And so if you see someone that has more of decreased concentration and not able to learn and are challenged, that's a sign that somebody may, have some form of some mental health problem or issue going on. People that have good mental health express their feelings, and they're able to manage a range of positive and negative emotion. People that have poor mental health have more challenges. They have mood changes and dramatic shifts in emotion, that being depression, anxiety, or they might even get agitated. Somebody who gets angry real easy, where normally they aren't that way, might have something going on. It doesn't mean that they absolutely need to get treatment at that point, but it just means that something's going on with them. People with good mental health also form and maintain good relationships with others. And what we see is people with mental health issues do struggle with social interactions and relations with others, particularly family members and friends. Many do socially withdraw and aren't able to manage that. People that have good mental health are confident when faced with new situations, and people with poor mental health have fears and they worry. Worrying occurs too, and again, there's degrees of excessiveness with that. People with good mental health don't always blame themselves for things, where we find people with poor mental health blame themselves and also have a lot of feelings of guilt. Doesn't mean that everybody does. It just means that for some people, that's what is their mental health issue. People with good mental health can set goals. And they can generally work through their priorities, where people with poor mental health have no goal setting and they're unable to meet a lot of obligations. So people that aren't able to meet their daily obligation have some issues going on, and that needs some attention. It doesn't mean that you have to go to the hospital. It doesn't mean you might just need to talk to somebody, and maybe a good friend or confidant, you'll be able to do that without any problem. Where other people, it might be better if you did talk to somebody that could give you a little bit better ways of coping, and that you could learn and to manage the situation that you're facing with better. And last but not least, it's not the only thing, but people feel good about themselves when they have good mental health and they're optimistic. Where people feel that have some kind of mental health problem have a sense of worthlessness and poor self-care. So we don't always see that they're taking care of themselves, and they're many times hopeless and helpless. Now, again, this is on a continuum, but what we're talking about for the majority of people, and probably the majority listening here, they don't necessarily need the most emergent mental health that you see, but there's plenty of room in between. We have mental health services for people who need it. Just like if somebody had high blood pressure and needed to take a hypertensive medication, it's no different than a mental health issue where we have to talk about things. It's not always a medication that we give people. And then when we look at emergent mental health issues, we're looking at people that are suicidal, very hopeless and helpless. So they're on the extreme of that continuum of the poor mental health. They're at the point where they aren't doing things that they should be doing regularly in their everyday life. They may get to the point where they're so stressed and unable to manage their emotions that they have auditory or visual hallucinations. Not everybody develops this. There's no course with that. It just is one thing that you might see that would signify an emergent mental health issue. The other one is if people are dangerous to themselves or others, or if they engage in risky behavior. So practicing good self-care strategies is something we should do all the time, all of us, and we all pretty much know what they are, but it's helpful to reinforce it. I think people think if you have really good mental health that nobody's doing anything to help themselves, and we all need to do these self-care activities regardless of where we're at along the continuum, and that would be eating a healthy diet, getting exercise, getting a good night's sleep. Are these things going to happen all the time? Probably not, but it's still important to keep in mind that these are self-care things that do actually help us maintain good mental health. So practice good hygiene. Make sure we participate in enjoyable activities every day. Stay connected with our friends and our family. Practice gratitude. Set some goals and priorities, and feel a sense of accomplishment. And then make sure you include relaxation in your day or in your week and what you do, and avoid alcohol and substance use as an option, as a coping strategy that you would use. So what do you do if you're concerned about someone's mental health? It's okay to talk to the person. When you're worried, tell them you're worried about them, or you're concerned about them, and you notice they just don't seem the same as they were before, and ask them what's going on. They will talk to you. They will tell you. For those that go through that mental health first aid, there's a acronym that they use, LG, meaning ask them if they will talk to you about what you're experiencing. Make sure you're reassuring to them. Make sure you're non-judgmental. that you listen non-judgmentally, that you give reassurance to somebody, and you encourage appropriate professional help as well as self-help and other strategies. So the majority of people that we see that need mental health services are people that function every day. They just need that extra support for their mental health, and that's okay. As we saw with, national athletes, it's okay to ask for help. It's okay to say, I need to stop and take a minute and get myself back on track so that my mental health is just as stable as my physical health. And we're going to talk about some professional help that is available. If needed, see if they are willing to get help. And it is okay to ask somebody if they feel like they're going to harm themselves, or if they are going to feel like they don't want to live anymore or want to harm themselves. You just don't want to leave somebody who says, if they are feeling that way, we just don't want to leave them alone. We need to get professional help to them before they leave so that they don't end up doing anything to harm themselves. But that's an extreme case. That's not something we're going to see necessarily all day, or every day, but it is certainly something to keep watch with. And the other myth with that is that just because you ask somebody if they're suicidal, in no way means that they're going to go out and try to kill themselves now. So there is a myth that if the more you bring it up, the more people will do it. And that's just simply not true. We need to find out if people are not able to cope to the point where they don't want to live anymore, because we can help people from harming themselves and committing any suicide. So I have up on the screen some treatment resources. This is just off the Michigan website. And because of COVID-19, the Michigan Department of Health and Human Services has really, I think, identified many different programs for people who are struggling or need some help to get through. It's offered to anyone who can identify an issue in their mental health related to COVID-19. So they have Draw Your Feelings, Stay Well. That's for kids 2 to 10 with their parents. They have a summer resilience series of all different kind of things for keeping people resilient in these times when things are different for us. And Be Kind to Your Mind offers some actual virtual support groups and different webinars on different topics that people might have. There's some for grief and loss. There's some for teenagers. There's just a wide variety of things. So I would encourage people to go to that website if you feel like that would be helpful for you, to go to a virtual type setting and stay in your own home and not actually go anywhere. For people that need outpatient treatment, there's a lot available. I have a few up here, and obviously, McLaren Bay Partial Hospitalization Program, I have listed there. It is something that we offer on our Midland campus, or on our Midland Street campus. And that's a day treatment center for people who don't really need inpatient treatment, but need a lot more support than just outpatient appointment. And so people get 6 hours of therapy. Usually it's 9 to 3. You can refer yourself. You do not need to be referred by any physician. And it usually is Monday through Friday, 9 to 3. And we take people who have all different kind of issues: loss, grief, depression, anxiety, just a wide variety of opportunity for people to get support. And what we find is that people do very well in the program, and they appreciate the services that they're given, and it does help them. So I would encourage people to call the numbers at the bottom there, as well as some outpatient programs are Liz Psychological. They offer therapy and limited psychiatry. They say they're located on Washington Street. Delta Psychological offers therapy and psychiatry. And then Michigan Psychiatric Associates, MPA, is another outpatient treatment that we find. So one thing about outpatient treatment is if you're interested in just talking with somebody about issues or problems that you might have, it's important to go to a therapist. If you feel like you need medication for treatment of your issue, that it's fine to go to a psychiatrist or a primary care physician. But a therapist is the one who's really going to talk with you. They're the people that you want to go to when you just want to talk to somebody. And some people need both, and that's okay. So I just wanted to make sure that I mentioned that. And then obviously for emergent mental health that we talked about, suicidal Those that don't want to live anymore, don't feel like life is worth living, have been unable to perform in their daily life, they might need some emergent services. And you can always go to an emergency room at a hospital, but you can also contact emergency services. I listed Bay Aranac, Central Michigan, Saginaw is also there. And always have the National Suicide Prevention Hotline available for people. Sometimes this is very helpful and needed. So at this point, I just wanted to remind people it's always okay. It's okay not to be okay. And we can get help for that. So please break the stigma. And we're so grateful that we had this opportunity to talk today. I'm so grateful because it's a topic that's near and dear to my heart. And certainly we want to make sure people get the treatment that they need.
Thanks, Bridget. Okay, a couple things before we get to the questions. You had mentioned beforehand when we were kind of talking about the presentation, something about the Olympic on-hand psychiatrist. Do you want to talk about that? That was such a great point that you made.
Yeah, thanks for reminding me. So I read a Time magazine article about Simone Biles and about how this is, this topic has come up. And so the psychology team that they have for people at the Olympics, they talked about how they have about 10 referrals a day from athletes. But the interesting thing is it's not the athlete that always brings it up to them. It's actually the people that are near them and work with them and are around them that notice a difference. And that's no different than what we see every day. We see people who look, just aren't acting the same way, just don't seem to be right. And the same thing happens with an athlete. I mean, there's no difference between a top level athlete's mental health and our mental health. So I think once again, it just shows that that still remains significant, is that people don't look at mental health issues anywhere near the way they look at a physical health. So I thought it was interesting and how, appropriate it was and that's exactly what we see today as well, is that someone else is concerned about them, they bring them to the hospital or they talk with them, and it's usually not the person who's struggling. So that's why it's important that we know how to help somebody and get the treatment that they need.
Awesome. And that's such a great story and very true. The other thing I wanted to say that wasn't really mentioned in the presentation is so many individuals are choosing self-medication with substances to treat their mental health problems. And as everyone I'm sure watching knows, that is a huge problem in our community. So I think that, if you see somebody that's acting off or out or abusing drugs or alcohol, anything you want to say to that before we get to the questions?
Yeah, I think, it is a easy way to think that you're helping yourself because it gives you immediate gratification in some ways or relief from your anxiety and stress. But it is a sign that there is something going on mentally and that your mental health will only probably get worse unless you really work to help get yourself in some kind of treatment without drugs and alcohol, that it will just be a continuous cycle that we see. And it's important that we treat those because those are not purposeful things that people are doing. People aren't going out and purposely, having trouble stopping drinking or taking drugs every day. It's something that's physiologically in their system and body that we need to work on, just like it is if they're hypertensive or have heart disease. It just needs to be worked on probably over and over. There's things that happen that repeats, and they need to make sure that they are able to help get themselves treatment. And there is treatment available. Our partial program does work with people that have used substances as well. It's not like it's something totally different than what we see with anyone with mental health issues. So make sure that you can find the appropriate treatment that you need that works for you, because there's a lot of different options for people.
I do really appreciate this. And on a personal note, my sister struggled her whole life with anxiety and went down the path of drugs, and which led to heroin. And I lost her from this. So this is definitely something that is very near to my heart. She just didn't want to seek help for it and chose the easier route that was available readily. So thank you, Bridget.
Mhm.
We have some questions that we are ready. The first one is from Heather. When is an appropriate age to talk to my children about mental health?
I think it's great to talk to them at any age. I don't think you'll want to necessarily call it mental health, but you just might be taking care of yourself, loving yourself, liking yourself, doing things that are helpful to yourself, and just maintaining good health and just being the best person that you can be. So I think there's ways of talking to them and saying, it's whether they like a dress that they're wearing and they're pretty, or to bring that up as a compliment, and do things that are that help a person's self-esteem. So a lot of compliments, all that sort of helps people's mental health. And we don't have to necessarily point it out as mental health. They're just things that are good to do for people in general.
All right, great, good advice. Next up, we have a question from Grace. Grace wants to know, are there any resources out there for people dealing with mental health issues? I know you talked a bit about outpatient, maybe discuss some of the other treatment options if outpatient or partial hospitalization isn't appropriate.
Yeah, so I talked about partial hospitalization program because I feel like it's more of what a community would not need, but would benefit from, just because there's many people that aren't at the extremes of an emergent mental health, but there certainly are people that are. And for those people, there's emergency rooms, there's emergency services through your community mental health agency. There's with people with substance abuse, there's inpatient treatment, there's residential treatment, there's outpatient substance abuse treatment. With mental health in particular, if you're looking at depression or anxiety, there are inpatient units that manage and work with people with mental health issues specifically. It's a little hard to give specific recommendations because everybody has a little bit different way of seeking treatment and where they might be living. And so I gave you some that are specific to what we use to transition people from inpatient to either a partial program or an outpatient setting, and that we found helpful. And it is very hard to find psychiatry services in this area as well as across the nation. We are in a national shortage of psychiatrists, and hopefully we will have more interest in people becoming psychiatrists, because we definitely do not have near what we need in this community as well as many other communities. So I hope if someone needs additional information, if you just could be a little more specific, then I might be able to help you seek the appropriate treatment that you might need.
Great. And because of the shortages, really fast, the telepsychiatry has gained popularity too, correct?
Mhm.
There's
Yes, it has. Very much so. Very much so. In fact, there's many different places that are doing therapy specifically through telehealth, and they've continued to do that throughout and continue to do it today. So if that's something that would be more preferable to somebody, then it would be more beneficial. That would be an option for you. You would just probably have to call and find out who might be doing that.
Gotcha. Okay, great. This next question, I recognize the name. This is Scott Ellis. He's the executive director of Great Lakes Bay Pride. And his question is, do you have some resource recommendations specifically for our LGBTQ plus community members?
That's a really good question. And off the top of my head, I don't know if any are not specific to LGBTQ community. I don't know of anyone specifically geared towards that, though. So I apologize. I don't have anything specific. If I do find something, Scott, I will let you know, okay?
And actually, Bridget, maybe you can speak about the higher prevalence in the LGBT community, especially the youth who are struggling with their identity. Do you want to speak to that at all?
Yeah. We have seen more and more that people do struggle, and they have special needs and things that we are all learning about how to work with them better, how to make them feel more comfortable and feel that they're getting the treatment that they need with the issues that they're experiencing and going through. And certainly, I think we've come a little ways, but I think we have a long way to go in making those people feel comfortable. And they certainly do need any and all the mental health support that we can give them.
Great. Thank you so much, Bridget.
Mm-hmm.
Our next question is from Marjo. She wanted to know, are there any free resources for therapy in the community?
You know, I would try the Michigan Department of Health and Human Services. I think that would be a great opportunity and option for somebody. If you really want to go talk with somebody, I don't know if there might be some people in congregations or church-related. You know, a lot of churches do have some group of people who do some type of therapy at some point in time. I can't think of. I mean, Catholic Social Services might have some. We do have that on our list of resources for people. Other than that, I'm not totally sure if there's how many are free, but I do know there's a lot that do a fee for scale based on your ability to pay or not to pay. So I would check those resources out if possible.
Great. Okay, perfect. Our next question is from Grace again. Are there any kind of support groups available in Bay County for people if needed? So perhaps it's not they're necessarily struggling with mental health, but maybe they live with someone who is. What do we have available in the community that you're aware of, Bridget?
Yeah, I'm not sure. We have a depression and bipolar support group at actually McLaren Bay Region that I still think is actively participating in, and they attend at a room at McLaren Bay Region. Specific support groups in Bay County, I don't honestly know of any offhand that I can specifically talk about tonight, but I'm sure that they do have some. I know we offer some with different things. We don't currently have a support group going on for mental health, and maybe that's an opportunity for us to take a look at that. So I'm happy to talk to Grace about that. Good question.
Perfect. And if we find any, we'll make sure to leave them in the comments of this video. So that gave us some homework to do.
Yeah, exactly.
So next up, Gina has a question. Has there been an increase in mental health needs in the community?
Definitely, for sure. COVID-19 has hit us all very hard and has forced us to find opportunities and work with people in a different way. Those that need physical health, using telehealth, as well as those that have mental health problems. And so we see a huge need. We've been sort of all alone and isolated for such a long time that now that it's, we're sort of expanding a little bit, but still we have the threat that COVID-19 will still bring back some isolation and separation that we may have to have with people. And I think that always increases our need for mental health treatment. And so we do see an increased need, and we're hoping that we can get the word out that there is treatment available. Again, it's just like anything, we haven't tapped everything because we have some opportunities with support groups and other different avenues that we should be, what am I going to say?
That we should be looking into pursuing. So
thank you.
Yeah,
Thank you.
I think this is a really great opportunity for just some great feedback from the community. And, we're always willing and welcome to anything that we can do to help. So Gina has another question. Everyone has sad thoughts and feels down sometimes. How long should somebody wait before they seek help?
Well, I think it depends on if you, there's no specific time frame per se. What I would say is if something's bothering you to the point where it's interfering with your daily life, for some people that could happen immediately. For other people, it might take a couple weeks for that to happen, or a month or so. But anyone struggling for greater than 2 weeks, I would say, should really, really look at trying to see what they could do to get some treatment, because there's no reason to suffer needlessly when there's services available. And we could all use a little, everybody needs help every now and then. And we need to, again, be able to talk about that and not have it be such a stigma. And it would be no different than if we were to go to the doctor and get our blood pressure checked. We go to a therapist and we get our mental health checked, or, we get a checkup. And so I feel like 2 weeks is about the time frame that I would guesstimate. You shouldn't let things go much longer than that. But again, and then again, I say that, but if you're grieving, it's going to take you longer than 2 weeks. So some things might last, a month or two, and you might not be feeling good. The real measure is if it interferes with your daily life. If you can't fulfill the obligations you do in your roles every day, whether that be a mother, someone who works, then that's a sign that you might need some additional support and help sooner than later.
Gotcha. And maybe even if it's not professional help, reach out to your friends, your family, ask for people
Absolutely.
to help you with washing the dishes or watching the kids or something. So,
Absolutely.
yeah.
Absolutely.
All right. So we have one last question. So this was from Marjo again. If we see someone in our lives that clearly needs help, but they aren't a direct threat to themselves or others, is there anything that we can do? So what does that process look like?
I think it looks like making sure you check in on them, making sure that you reassure them, making sure you ask them if they're still feeling okay, make sure you let them know that you care about them, that there is help available should they want to get the help. And if you see signs of people still isolating, again, not certainly not themselves, but to the extreme of, self-isolating, not fulfilling the obligations of their daily life, then I think it's time to maybe push a little bit harder to get them some help and identify resources that might be available that they hopefully will be willing to take. But that can be challenging, I know.
Thank you so much, Bridget. We really appreciate the time and the message that you shared with us today. If anyone has any other questions for Bridget, they can feel free to leave them here and I will
Mhm.
make sure that she gets them.
Mhm.
And we have some homework to do, as we said.
Yeah,
So
it
we'll look
is.
into some stuff. But
Yeah.
thank you so much, Bridget, for being here. And yeah, it's
Thank
been
you. I appreciate the opportunity. And remember, it's always okay not to be okay. We just need to get help when we need that, and it's okay.
excellent. Thanks again. And for everyone else out there, please keep watching our McLaren Bay Region Facebook page. We have lots of great community events that we have out there, support groups. We have an upcoming peripheral arterial disease screening coming up that we'll have details on, including a Facebook Live presentation from Dr. Muad. So stay tuned for more. And thanks again. Take care.